Here is a quick video demonstrating the setup and administration of prolonged IV antibiotics. The order is in the MAR and it's time to administer the antibiotics. You're going to verify the 7 rights of medication administration and then begin to obtain your supplies. The most important thing here is that you obtain a new straight set tubing without ports for each new dose. Because these antibiotics are prolonged, they are ran over a slow rate, which is why you need to prime the line. First, clamp the tubing, then spike the antibiotic bag with the primary tubing, squeeze the drip chamber, and prime the tubing with the antibiotic all the way to the end of the line, leaving no air bubbles. If you're infusing through a central line, this should be a sterile prime. Next, you're going to bring the primed antibiotic line to your patient's room. You're going to scan your patient's wristband and the medication and re-verify the 7 rights of medication administration. Now place the tubing inside the IV pump. Click Channel Select on the ORS pump. In this case, it is Channel A, then Guardrail Drugs. In this case, we will be doing Zosyn. Now program your drug dosage and then the volume. Always double check. And then the duration that the healthcare provider ordered, so 4 hours in this case. And always double check the rate. Zarina's scrubbing the hub and letting it dry. Next, you're going to connect your primary line to the hub of the peripheral IV or central line closest to the patient. Ideally, this IV should only have the antibiotics connected to it. Fluids and everything else should be on a different IV. Do not wire or connect anything else into this line. Unclamp, press start, and assess for dripping in the drip chamber to confirm that the line is unclamped and the antibiotic is now running. Set a personal alarm for 1 hour, and during your hourly peripheral IV assessments, be sure to also assess the bag to ensure everything is still connected and that the medication is infusing. When the bag is near empty, keep a close eye to prevent the drip chamber from becoming empty because we do not want air in the line. If there is medication still present in the antibiotic bag, squeeze the remaining medication into the drip chamber. Now you may hit pause. When the antibiotic bag is completely empty, you're going to now spike a flush bag, because at this point, the remaining medication is in the tubing, which is approximately 25 milliliters, and the patient must get the full medication dose. Once your flush bag is spiked and ready to go, you're going to continue your infusion at the same rate. Hit start. Once again, assess your patient, assess their IV, and ensure that the medication is infusing through the line. After the remaining 25 milliliters is infused, the pump will beep infusion complete. Your patient has now received their full dose of medication. Next, disconnect the tubing and discard it in the sharps container. When errors are made in this process, the antibiotic is then delivered at the wrong rate or the wrong time. Beta-lactam antibiotics operate on time-dependent pharmacodynamics, so maintaining consistent antibiotic concentrations rather than high peak concentrations is crucial for effective treatment of infections caused by susceptible bacteria. Please be sure to remember to document infusion complete in the MAR. Thank you.